It's my pleasure to introduce to you Dr. Gretchen Moen, DNP, APRN, CPNP. She's a pediatric nurse practitioner. We've had so many people have pediatric questions today. So excited for you to speak. Founder and clinical director of Dakota Child and Family Clinic, a nonprofit charity clinic in Burnsville, Minnesota. The clinic is grounded in the NP philosophy of patient-centered holistic healthcare. She received her undergraduate degree from the University of North Dakota, basic nursing from Normandale Community College, Master's of Science Pediatric Nurse Practitioner focus from the University of Minnesota, and a Doctor of Nursing Practice from the College of St. Scholastica. She taught graduate nursing at St. Catherine University for over 13 years. And Gretchen was also one of the first pediatric providers participating in the Minnesota Medical Cannabis Program. Dr. Moen believes that medical cannabis is another tool in the toolkit for children who are struggling with typical treatments for their qualifying conditions. She was instrumental in developing the petition to add autism spectrum disorder to the list of qualifying conditions in Minnesota. Please welcome Dr. Moen.
I have all these way up here people talking before me, and I'm a pediatric provider, and we have plain speak. So if I mispronounce some of these words, please have patience with me. We're really here just to talk about the pediatric experience that we've had since the beginning of the medical cannabis program in Minnesota. The very first patient that I certified was actually a child with Tourette's disorder, but he had multiple other problems. And I remember his parents saying, "You need to become a certifying provider." And she basically took me by the arm and said, "Go get yourself certifying. I want to try this for my son." I was a little bit hesitant, like everybody else in my field. Really? Cannabis? Kids? I'm not sure I want to do that. But I was really happy to do that, and it was amazing, the results that happened from that. So I was quite happy with that, and I don't know which one it is here. I got it. It finally showed up. Okay, so I'm not going to go over all the details you already got. This is stuff that other people already talked about. The review, we've talked about that before. The receptors, what's going on. The big thing I always want to explain to my parents is that there's really no lethal overdoses attributed to cannabis, and within the pediatric population, we're very sensitive to monitoring the types of product that they're getting, the amounts of each of the components of the product, and we treat medical cannabis as a regular clinic visit. So you don't just come to see me once a year and get, your cannabis certification. And if that's the way you want to do that, you're not going to come to me, because that's not really a good way to provide health care to anybody. So we talked about opioids already, so we don't need to talk about that. So really, we talk a lot about CBD and THC, and in my clinical experience, CBD is sort of like, the gold standard. I mean, CBD is sort of what makes everything seem to work better for kids. And I really do tell parents to kind of not get as much THC to start with. You talked about starting low, going slow. Start with the CBD, maybe a little bit of THC if you need it for sleep, but really, let's give it the benefit of an adult. It's a whole body response, and so you got to give it a little bit of time to kind of do that whole body response. It's not like taking Adderall and the next day you can pay attention. It doesn't work that way. We do talk about the metabolic pathway. We talked a little bit about the enzymes going on. I just wanted to include some information here on what some of the interactions might be, just for your information. That doesn't mean you can or can't use these things. You just have to use them with caution and be prepared to monitor both the cannabis use and the use of these medications. Really, in pediatrics, everything's based on recreational use. All the identified risks, everything that's going on is recreational use. It's really related much more to the THC level than the CBD level. The higher levels of THC, the more concern about risk of problems going on. And with that high level of THC, you'll see things like decreased motivation, mild cognitive decline. They talk about addiction, schizophrenia, again, these are things that are found in the literature. I'm not sure I buy into all of that. But the data does suggest that risks are elevated in children who are less than 18 years of age, and a lot of that has to do with the amount of development that's going on in the brain. And obviously in families who have some other psychiatric disorder, specifically schizophrenia, or the use of alcohol and tobacco together. All of those things we know sort of are psychoactive on the pediatric brain, so we just have to be real cautious. And I spend quite a bit of my time talking to my adolescents and young adults about the risks of using medical cannabis and then, recreational drugs and alcohol and recreational cannabis, because you're not really helping yourself at all there. And then the animal studies talk a lot about CBD use or analogs and, some short-term adverse effects, which are, some weight loss and increased liver transaminases. But again, short-term is the key word here. Again, TH use is all about dose dependency. The Entourage Effect, we've already talked about that quite a bit. And we put in here that it's a little bit controversial because you'll read the literature, as we were saying, we don't have enough to really support it as much as we believe that it's very helpful. There's a lot of research that says, hey, it's better to have that single thing. We know exactly what we're doing. We know what we're working on. Not really. I think the combination, the nutrition and analogy was wonderful. I use that all the time. It's better for you to eat the food than to take the vitamin. Eat the food. Let's talk a little bit about the different disorders that I've encountered within my practice. We talk about seizure disorder. Everybody's pretty familiar with the activity of medical cannabis on seizure disorders. We've gotten the history a lot. What I really wanted to talk about with the patients that I've encountered was some of that somnolence is a big thing, and it goes away, but it's hard for parents sometimes, like, oh, is this another seizure? Is this a different kind of seizure? They're sleeping all the time. I don't know what's going on. And so they get really nervous. And so I work quite closely with a neurologist, a whole neurology group that helps kind of co-manage these kids. And so we help each other train the families to understand that this is a side effect that will be there, but it's going to go away. You just have to kind of have some patience. And then when it doesn't go away, then we need to be more concerned. The appetite and weight issues, again, that's sort of temporary, and we talk about ways to support them nutritionally and through that sort of phase as we're finding the right dose for those kids. I haven't had anybody with a lot of diarrhea, but we've had some people with increased seizure frequency, and then I think that has a lot to do with their genetic phenotypes, and so we refer them back to the neurologist, and then they really don't use the medical cannabis after that. So, as I said before, much of the seizure care in pediatrics occurs through the neurologist, but there's a few cases that we have managed within our clinic. And so we had 2 children who came back to me after 4 months after initiating their medical cannabis, and they had after about 3 years, they had no other seizure medication. They had no impact whatsoever on 4 of the children. 7 of the children saw an attenuation of their seizures, but they were not able to completely eliminate the seizures or the need for seizure medications. But the overall medication load for those 7 children was reduced by 68%, which was really kind of a big deal to me. That says a lot about how well it works. One thing that was across the board, whether it worked or not, everybody was so glad they had the opportunity to try it. And I thought that said a lot about where we've come in healthcare, that we're willing to allow people to try things that we feel really confident about. And the families were really grateful, even if it didn't work, that they had that opportunity and they knew that they had tried everything that they possibly could for their child, which I thought was great. Autism, obviously that one's near and dear to my heart, but that one is really kind of interesting. We talk a lot about what does autism come from. I mean, we know some genetic backgrounds, but really one of the things that we're looking at is really the association with pro-inflammatory mediators. We talk a lot about, is there an inflammatory response that is going on that causes the brain to function differently during, development in utero or shortly thereafter. We have parents that say it's not immunizations, but that's kind of what they think. And so we think about, is that really what's going on? We've heard a lot today about how medical cannabis is such a anti-inflammatory. It's just great. And so I think that's one way to think about this when I explain how I think it helps the brain with children who have autism. Again, remember the whole body response. So we're talking about the gut piece here too. So we know that CB1 receptor is in the frontal cortex and subcortical areas, and we know that CB1 and AEA and 2AG, I'm not going to say the words, I'm just going to use the little letters, regulate social play, which is one of the big deficits that we're finding in people who have autism spectrum disorders, that social play, that social interaction. So the activation of the endocannabinoid system in the nucleus, and I'm not even going to say it, accumbens, is that right? Occurs there. So AEA mobilizes and results in the activation of CB1 receptor in this area of the brain. The process is driven by oxytocin, and that's why you'll see some people have tried oxytocin as a treatment for autism spectrum disorders. There was a study at the University of Minnesota where they're using oxytocin spray to kind of help some kids with their autism. We know that the ADA signaling decreases oxytocin. So what's going on, we think that there's actually an overall deficit of the endocannabinoid system in general in children who have, or adults too, but children who have autism spectrum disorders. So if we can supplement that, maybe we can help retrain the brain to be able to participate in social play and language and some of these other things. The other one that we need to keep in mind, the neurotransmitter, is GABA in the brain, and this reduces neural excitability, and we talked a little bit about that. Checks and balances are, one-way, two-way responses. There's a notable decrease in GABA activity with people who have autism spectrum disorders too. So when they're neurologically excited, there's no way to kind of calm that down a little bit. And we do know that CBD can help with that a lot. This regulation of the endocannabinoid system is important to the pathophysiology of autism spectrum disorder, as I said. There's limitations to pharmacotherapy, and I think what really helped our petition go through was looking at the kind of medications we have to use to treat the big areas of eating and sleeping and pooping and peeing and activity and safety. And so you start looking at the multiple medications and their sort of combined effect on that poor little growing body, and it makes sense that we should try to find something that works a little bit more holistically, and maybe you don't need to have so many medications. So a lot of the kids that I have seen in my office have run the gamut of medications. They come in with a med list that is as long as my arm, and they've tried that many that they have failed, and they're still on that many when they come to see me. And it's not just because they haven't given it a shot. They really have. And so a lot of times they'll have aggression. That's like the number one thing. And then self-injurious behavior, the beating of their head, the chewing on the pulling at their skin, things like that. And some of that, I think, is side effects of all of those medications that they've been on, that combination. So we try really hard to walk through how that will look if we decide to go ahead and try some medical cannabis. Lots of the side effects of those medications, atypical antipsychotics have that insulin resistance and the weight problem. We have alpha-2 energies can change your blood pressure levels. They can get dizzy. I had a little girl, she was on a very small dose of clonidine, but every time she stood up, she'd pass out. I'm like, wait a minute, I think that's your clonidine. And then SSRIs, we know about some of those side effects. So let's kind of keep in mind that all of those combinations, I have children who have all of these medications at one time to try to help manage their behaviors. It's ridiculous. So we looked at the studies, or at least I looked at the studies of individuals with severe behavioral problems. And there's a very high efficacy in mitigating those behaviors and a high tolerance of CBD. But it takes a little bit. And I think this is the part where, a lot of times this is your parents' last-ditch effort, and it's going to take more than just 2 or 3 days for you to see the problem. So we have to be a cheerleader. And we're not going to stop everything. What we're going to do is we're going to add this and then start pulling things away. But we really need to be that cheerleader and hold their hand all the way through that and bring up the small little things that we see when we're monitoring this. Because, when it's in your face, you're not always seeing those small steps. For instance, I had a young man who refused to even come into clinic. He was so afraid. He'd been manhandled at every clinic he'd ever been at. He'd been held down to get his shots. He'd been, 5 people to just do a strep test. He was nonverbal. He was scared. And they were coming to me to talk about medical cannabis. And I said, okay, sure. Well, let's try it. He was only on about 4 medications at that time because they just had enough of medications. But he wouldn't even come in the clinic. We call this a car visit. We sat in the car outside. We do a lot of car visits. And did what we could. And my staff was really good about getting vitals and everything. And I really applaud my staff. They're very flexible. Anyway, so we sit in the car. And Mom and Dad were apologizing up the yin-yang because he wasn't coming into the clinic. And I said, this is nothing. I mean, I can understand why they won't come into the clinic. So our protocol is that we'll certify you, and I need to see you a month after you've started the medical cannabis. And then we follow you accordingly after that pretty regularly. So at their 1-month appointment, they hadn't really seen much change. But he got out of the car. So to me, I saw some change, right? But they didn't see the change. At the 6-month visit, there was a couple in between there, but at the 6-month visit, he actually came out of the car and came into the waiting area. He wouldn't go back to the room, but he wasn't having a big meltdown either. At the 1-year visit, he came in and said, "Hi, Dr. Gretchen," and gave me a hug. I'm like, whoa. And we had gotten him off of all of his other medications at that time. We were literally on high CBD medical cannabis. It was, to me, really, that was one of the early ones for autism spectrum disorders, and it really solidified my commitment to wanting to have this available for pediatrics. So I took a survey of 85 patients within our clinic and kind of have a little bit of results for you. Really, the bottom line is they all felt like there was improvement in some of the symptoms. The number 1 and number 2 is behavior and sleep. Those are the number 1 and 2 symptoms that I see that patients coming to me are having trouble with, and all of them have had improvement with behavior and sleep. Appetite, sometimes I see that happening in year 2 when they're starting to increase that mental flexibility about trying different foods and maybe putting it in their mouth for a while. I don't want parents to give up on their speech therapies and all of the other things that they're doing, feeding therapies and all that stuff. I really feel like, but they're starting to actually take hold and starting to actually stick. And so the patients are starting to be able to use some of the things that they're learning in those therapies, which is really exciting for me to see too, and I think parents too, although they're sort of like, I still go to speech therapy. Well, I think you need to keep going, but you're going to start to see some differences. I talked to a colleague of mine who also sees children with autism spectrum disorders, and they reviewed 117 charts of kids who had medical cannabis. 15 of them had ceased medical cannabis because they didn't really find any change, or the cost was a little bit too high for them. Of the remaining 112, they had moderate to significant, so if you use a rating scale of 1 to 5, they had scored 4s and 5s on improvement in quality of life, and 4s in social reciprocity, which was pretty impressive to me. And then 3 to 4 in elimination patterns improving, which means a couple of them had actually been able to stop using their diapers altogether. A couple of them were having bowel movements every day, which was something that was unheard of prior to that. And then a lot of them had 4 and 5, mostly 5, on behaviors improving, and then their 4s for their improvement on nutrition. So they were expanding their eating. I had one family, literally, you guys, these are not stories you haven't heard before. The child would only eat McDonald's French fries, Burger King cheeseburger, Chick-fil-A soda, and Dairy Queen ice cream. So every night, the family was going to every one of those places and buying his supper. I was like, okay, first of all, wow. But anyway, impressive for a dedicated parent. But he also, this young man, tried medical cannabis, and we didn't get him to stop it all the time, but we were able to slip in a few different foods every now and then. As long as they drove around, we were able to slip in a few foods. Without the driving around, it didn't work. But he didn't always eat the same thing every night. He added 4 foods within that year, which I thought was pretty impressive. Anyway, all the families, again, just like the children with seizure disorder, were so excited to have had the opportunity to try medical cannabis. Tourette syndrome was one of the first, like I said before, disorders that I was able to certify kids for. We know the background, the pathophysiology of Tourette syndrome, and the treatments. I mean, haloperidol, really, I just want kids on that all the time, right? And then aripiprazole and clonidine. I mean, we see that used, but it's only somewhat effective. So we talk about using medical cannabis for movement disorders and tic disorders, and there's a lot of research that's saying, hey, we should try this because it's it's helping with the GABA signaling, it's helping with the neurotransmission in the brain. So there is a question about whether or not you just continue therapy and add it, or if you stop. And basically, I am of the mindset, add it to what's there and then start moving down from what's there, unless there's a direct contraindication. Otherwise, we won't stop everything, because then life could be a little miserable for a while, so we try not to do that. So there is also some pain associated with some movement disorders, so we already heard a lot about pain and the efficacy of medical cannabis for pain. So I think it's kind of stands to reason that you're going to see improvement in behavior with children who have movement disorders who also have pain associated with that. So this is the first patient that I saw a remarkable. I could not believe the change. So he came to me and he was 12 years old, and he had definitely Tourette's. He couldn't even complete 3-word phrases without at least 2 or 3 vocal tics. His head would turn, his legs would turn, he'd have to stand up, he'd have to sit down, he'd be doing the rubbing. It was just like constant movement, and he couldn't maintain his weight. He was just almost emaciated because he couldn't eat enough calories. It's not that he didn't want to. He was just having a hard time eating. He'd drink a lot of his calories because that was easier for him to control. And they had gone through the gamut. They'd had just a ton of different medications. They'd gone to a lot of different providers. And Mom said, I'm just here because I don't know what else to do for my son. And so he initiated his medical cannabis treatment. they lived outstate, and they initiated him on vaping, and it was an every 2-hour treatment. Well, you can't do that at school, which is a problem in pediatrics. We can't use any of this in school. And so he couldn't go to school because he needed his treatment. It really needed to be every 2 hours. And I talked with the pharmacist saying, really, does it have to be? And she goes, that's fine. Okay, fine. So he ended up doing homeschooling, and over the course of a year and a half, I think it was, by the time he was done, he came back to clinic, and I didn't even know who he was. He'd put on 28 pounds. He sat in the chair, and the only thing I saw him do was cross and uncross his legs a few times, which I see that all the time. So, nobody wants to be there anyway. And so, sat and uncrossed his legs. One time I saw his head turn. I heard no vocalizations during the entire time he was there. And he was able to carry on a conversation that he'd never been able to carry on before. And all he could tell me was how much better he felt and how much quieter his brain felt. And he was back in school. Because at that point, he didn't need every 2 hours anymore. He was down to a 3 times a day dosing with PRN. And he still had some trouble with his sleep, but in general, it was just amazing to me. And he is now 22, and he is down to 2 tablets a day, and that's it. And it's one's 50-50 and one's high CBD, and that's it, which is amazing to me, given how I really honestly didn't expect it to work that well. I was thinking I was still going to have to add something to it. It's been just fantastic. So that was a really good one for the Tourette's. I was really convinced at that point that, yeah. Let's see. Chemotherapy-induced nausea and vomiting. Again, a lot of this is being handled by our oncology team, but when I started, none of the pediatric providers would touch it with a 10-foot pole. So they found out about me. I'm on staff at a couple of the pediatric hospitals in town, and so they would refer them to me to help with this. So that was great. So I was able to help a couple of kids who were going through some significant chemotherapy regimens, and one little girl was losing weight just terribly, and they didn't know what to do because she was basically wasting away because she wasn't able to eat because she was constantly throwing up, and they had massive doses of ondansetron, and they even tried composine, which didn't really help, and some other antihistamines, and none of that was really helping. And so we were able to get her, and they had tried Marinol, but she just kind of went out of her head. I mean, she was just like kind of out of her head. So we started working with medical cannabis, and she was able to, it took about 4 weeks to be able to see a significant improvement, and then by the time she was done with her treatment, we were able to gain 5 pounds back of all the weight she had. She had probably needed to gain 25, but at least we got 5 pounds, so she was on her way, and she wasn't needing to have high doses anymore, and lots of doses. She was down to twice a day medication for medical cannabis, and nothing else for nausea and vomiting when she was getting her treatments. Yeah. Oh, 5 minutes. Okay, yeah. I'll hurry up and talk. Okay, sorry. Anyway, so this is the pathophysiology. Inflammatory bowel disease we've already talked about. I do have one more story on that one. I had a young lady who has autism spectrum disorder. That's what she was certified for because inflammatory bowel wasn't on there at the time. And she had significant inflammatory bowel disease as well, but her behaviors were just horrible. And I remember she was so uncomfortable. She was rocking in the chair and rocked her body right through the wall at my office. Put this big hole. I felt kind of bad for her. Like, whoa. Okay, it's a cheap office, but still. But anyway, and she was really, really not doing well. And she was on a handful of medications. And she also had a retrograde enema protocol because she couldn't pass stool and just all kinds of stuff. Anyway, I worked with her gastroenterologist, and I said, she's going to be certified for medical cannabis. And he goes, oh, I've been reading about that with inflammatory bowel disease. This is kind of cool. And so I did put it on the thing that she had this as well, but it wasn't a certifying condition. But I think that helped us work with the pharmacist on finding the right combination for her because she qualified for autism. She needed it for that as well. But we were able to find a combination that actually helped her inflammatory bowel disease. Unfortunately, kind of what we hear across the board with pediatrics is that she had 2 years of huge success, and then they had to quit because they couldn't afford it anymore. So now she's back on, methotrexate and Pentasa and, I don't know what other major pain medications, but this is her story. PTSD is kind of the last one that I talk about. My experience with PTSD is a little bit less stellar than what I've seen with Tourette's and autism. and the nausea and vomiting and the inflammatory bowel disease. And I think that comes more because of it being a multifactorial problem than straight up PTSD. I think, we're probably getting some benefit definitely from use of medical cannabis for PTSD, but because of all the other pieces, and a lot of my population are kids who are taken from the home, they've been in multiple foster placements, they've seen their parents kill each other, they've never felt welcome. I mean, there's so much more to that behavior than just the PTSD. But what I am seeing is that they're able to sleep, and I think we heard that earlier about PTSD too, that they're able to sleep. And I think that's probably one of the biggest things. I usually tell parents, if you can eat, and you can sleep, and you can poop and pee, you're probably going to be okay. But if you can't do any of those, then we have a problem. So all three of those things I feel like medical cannabis works on. So anyway, I have some best practices, and then I'll hurry up. So in pediatrics, we always talk about best practices, right? So use your clinical terminology, and we heard this a couple times today. We don't call it marijuana, we don't call it weed, although some of the adolescents like to call it that. But we don't use those terms because I want people to understand that this is a therapeutic type of treatment. It's not a recreational, let's have fun kind of treatment. We use guidelines within your practice for what you determine to be follow-up, particularly in pediatrics. Parents, they have so much else on their plate. So have some sort of a tickler system where we can remind them that they need to come back and see you, and you need to monitor them. Again, they don't all have to be in person, but you do need to lay hands on them at least once, right? And then coordinate your care with the other healthcare team that they're working with. A lot of my patients come from all over the state. So I'm obviously not their primary care provider because they're coming from all over the state. So I work with their primary care provider, their mental health provider, their school providers, and we kind of work together so that we're all lay eyes on that child to make sure that we're not finding anything to be unusual. And then really look for the expectations. Parents need to understand that this may be the miracle drug, but it may not. So as long as we can manage those expectations, and we talk about that all the time when we talk about neurodevelopmental disorders, let's just manage our expectations, okay? And then we'll be able to work through this together. And then find a tool that you can use to monitor for any of those side effects, okay? Talk to the PharmD, and I will tell you, they're awesome. I talk to them quite a bit. I send little messages through the cannabis registry a lot, and that works really nicely too. And then really get out there and talk to primary care providers about it, even if they're not willing to be certifiers. At least help them understand a little bit about medical cannabis so that they're not afraid of it when their parents or when their patients come in and say, hey, I'm getting medical cannabis from Gretchen down in Burnsville. So this is my resources. Any questions?